Welcome to all of my beloved colleagues today to our AKT session. This is myself, Dr. Osman Ganit. It's my humble introduction with you, our institute. Before going to the topics of discussion and the question, you just have a look to refresh your memory of structures of the eyeball, and behind there is optic nerve, as well as the layers of the retina down. So you see in the surface, this is sclera. In the middle layer is the choroid, and the inner one is the retina. And then interiorly, you see that anterior chamber, posterior chamber. Sometimes we say aqueous humor, vitreous humor. There are many diseases can happen in this anterior chamber as well. In the angle, there are some muscles controlling the movement, the shape of the lens. So all the things are especially the eye anatomy. Possibly we know most of us. Even then, just to refresh, so that during discussion we can understand where is the problem. So with this one, just have a look from the outside in the surface, in the skin. What are the structures? Just to remember this thing. This is the medial canthus, lateral canthus. That means the angle. You see the gland under the skin here, lacrimal gland. This is a punctum, superficial lacrimal punctum. This is the opening. And this is the lacrimal sac here. At the down, there is a nasolacrimal duct. Sometimes fluids, not sometimes, physiologically fluids coming from the ear to the nose also. When it is blocked, the flow is blocked and there is an infection. It will be the dacryocystitis, dacryocystitis. So this is simple anatomy, but if you look by the naked eye to the eyes, you see this is the pupil, this is the iris. Sometimes iris is pigmented in different colors. Some people having the blue iris also. This is sclera white and the conjunctiva covering the eyeball as well as the palpebra, the eyelid, under surface of the eyelid. This is the eyelash. In general practice, usually we are facing such problems. The lists are given there. But from for the exam purpose, definitely we will be highlighting these things. The causes of the red eye, dry eye, visual loss, painful eye, and common eyelid problem. Just to refresh and storm our memory, Dr. Rashid, can you say one disease of red eye you ever faced in your practice? Only one disease, red eye.
Sir, conjunctivitis, uveitis.
Many things you can say. Very good. And just to be interactive, other colleague, Dr. Neda, can you tell the dry eye? Have you seen any dry eye?
Yes, doctor. Usually, dacryocystitis occur, and most of the time, usually with females, I'm seeing.
Do you think that dacryocystitis is producing dry eye? This is an inflammatory process. This is an inflammatory process, dacryocystitis. How can you say that
dry
this is
also
dry
I see.
eye? There may be the primarily eye is dry, maybe due to senility, aging process. And another disease, dry eye, can you mention? Rheumatologic disease? Keratoconjunctivitis.
Yeah.
Not much common.
It's Sjogren syndrome.
Sjogren syndrome. Sjogren syndrome.
Yeah,
Right. Thank you. Now come to the visual loss, Dr. Sama. One cause of visual loss you have seen in your practice. I'm not willing to hear from the book. Visual loss due to what?
Actually, I just joined, so I don't know what they mentioned, but
say one disease name presenting with the visual loss you have seen in your practice.
I see in my practice. Actually, I didn't work in ophthalmology unless
it is
just
not a part
in my
of
internship.
Ophthalmology, even the internship or even your general practice.
Yes.
From any time. Visual loss due to what?
Arterial occlusion of central arterial
retinal
artery. So, yes.
Okay, okay. There are many other causes also, right? Painful eye, who will say? Dr. Rasha, can you say one cause of painful eye you have seen? Dr. Rasha? Painful eye.
Scleritis?
Scleritis. Have you seen Dr. Scleritis?
No.
No, I'm
Just from
asking
the
you
reading.
have seen any patient having
No,
painful eye?
I did not see.
You didn't see even
Glaucoma.
conjunctivitis?
No, painful?
Conjunctivitis
Because
also
I'm working.
causing mild pain, discomfort.
Yes.
Okay.
Acute closed angle glaucoma.
Glaucoma. Have you seen
Painful.
glaucoma patient?
Yes.
Very good. This is also one of the cause of painful eye. Very right. An eyelid problem, Dr. Shaza and Dr. Soha, both of you. Eyelid problem. Mention disease of eyelid. No thinking.
Lesion.
I saw
Sorry.
it.
Can you repeat, Dr. Soha?
Cyst something.
Sty and lesion.
Stachylasium. Yeah, many other problems, many other. Okay. Thanking you. We're going to now the topics on the cause of red eye. Cause of red eye. This is conjunctivitis. Okay. The right side, left side. Could it be viral or bacterial, doctor?
Yes.
Is it bacterial or viral?
This one in the picture, you mean?
Yes.
I think it is viral.
It is viral. Or right one is one, left one is another one. It is viral. This is bacterial. What do you think?
If there is
Left
virulent,
side bacterial.
Can it happen, doctor, in the same patient? The one eye is bacteria, another is viral? Unlikely to be. It is bacterial or viral. Both can happen. Whenever discharges are much more likely this is bacterial, but in the viral also it can happen. Let us see. Now look at the eyes. You see, without discharge, more likely viral. Just watering. The more discharge, it is bacterial, but it is not hard and fast.
Yes.
It is not hard and fast. This is not the same patient. It's just two eyes to be shown to you. Okay, so red eye is a very common cause, doctor. And let us see, I will discuss later. So the bacterial or viral conjunctivitis starting in one eye and often spread to the other eye. Okay. Second thing, in the management part, usually these are self-limiting, especially it is a viral, even the bacterial also self-limiting. But for the safety, we are giving antibiotic local. Chloramphenicol is a traditional one, can be collected OTC. But nowadays we are using tobramycin, ciprofloxacin, eye drops or eye ointment. 3 to 5 days is enough. But as a point of family medicine perspective, we need to advise to prevent the transmission of the disease. This is very, very important. Okay. How to advise? Just to wear the black glass and covering the eyes. Don't touch many utensils in the body, in the household materials, in the utensils. Okay. This protection is important. And how the disease is transmitted, doctor? Can you give an idea? Anyone? Disease in the eye? How?
Contact.
Contact means how?
Droplet.
Direct contact.
Using towels.
Droplet is the respiratory secretion, but disease in the eyes.
Using the towels together.
Yes, using the common towel. Usually common practice in South Asian countries. All the members of the family using a common towel with the wash basin near about or in the dining room. So it is a risky one. Second thing, that rubbing the eyes and touching somebody, other person. It is transmitting, rubbing the eyes. So we have to advise to the patient. And I will tell you in summary also later the red eye, how to differentiate, but you just have a look. Another one, what you are thinking as a cause of this red eye? You see, there are some findings. Here in the- This is called
Blepharitis.
cobblestone appearance. This one follicular appearance in the lid. So what is the diagnosis?
Blepharitis.
Hmm?
No, this is not blepharitis.
It is not blepharitis. This is conjunctivitis. This is conjunctivitis and allergic conjunctivitis. Allergic conjunctivitis. You see this allergic conjunctivitis. And look at their clinical pruritus. Redness is universal. Eyelid edema, chemosis. The edematous eyelid is called chemosis. Okay. Topical antihistamine and mast cell stabilizer NSAID. So allergic conjunctivitis, we have to use very gentle medicine, topical antihistamine. Topical antihistamine. This is one of the name of the medicine I have used here. Maybe well not known to everybody. This is the one of the trade name. Itching. Name is itching. Eye drop. What is the I, E and E, doctor? Why E oblique E written here? Just a pharmacologic point of view. Dr. Rashid? E.
Chloramphenicol.
No, E oblique E. What is the meaning of that? Eye and ear drop. This drop can be used in the eye as well as in the ear.
Yes. Both, yes.
Eye
Both.
drop, ear drop, same. Okay. And usually avoid topical steroids. Remember, we have the habit. Dr. Rashid, I don't know. What is your experience for allergic conjunctivitis, patient having too much itching? Sometimes we are using a steroid eye drop. So they are advising not to use eye drop of a steroid because steroid can be a cause of cataract also, because allergic conjunctivitis is a very long time disease. So if you use steroid long time, it can damage the eye by creating the cataract also even by the steroid. So better to use antihistamine, not steroid. Remember it.
Same time we'll give systemic antihistamine.
You can give systemic antihistamine, rather better to avoid a steroid. Or you need to steroid again, very cautiously for short duration. Now, what you are thinking, Dr. Hind? What may be the cause of the red eye here?
Hemorrhagic.
Subconjunctival.
Subconjunctival hemorrhage.
Yeah, doctor. Why it is not conjunctivitis?
There is defined redness, defined with the
Border.
yes,
Defined
the
border.
But yes.
very defined. Yes.
Not diffuse. That whole conjunctiva is not involved. One.
Yes.
And maybe symptom also important issue. Usually patients are asymptomatic.
Yes, no symptoms at all. We will find some maybe cough or strain, just like this, and it is
Maybe.
a sudden onset. Yes,
Yeah.
all of sudden on could be recurrent.
Good.
And
Trauma.
Okay. If you pull down the conjunctiva, what you will see in the conjunctiva?
normal
Normal.
conjunctiva.
Normal conjunctiva. So this is subconjunctival hemorrhage. Referral, if follows trauma, if due to the injury, then you will refer. Otherwise, no need to do anything. Usually, you can check only blood pressure of the patient.
Yes.
Okay, but if going frequently, then it needs observation or evaluation by the specialist. Conjunctival hemorrhage. So this is list differential diagnosis of the red eye. So red eye caused by disease in the orbit, in the lid, in the sclera, conjunctiva, cornea, uveal tract, that means the iris, and other cause of red eye due to acute glaucoma or any post-operative conditions. So for the GP, what are the common diseases you need to know about? Almost most of the cases are common in the general practice for the red eye. Okay, now come to a question. Dr. Rashid, may I request to read it?
Okay, sir. A 7-year-old boy presents with a 2-day history of irritated right eye. His father has been weeping away stringy discharge from the eye, and the eye has been stuck together in the mornings.
Okay.
He has no light sensitivity. On examination, pupils are equal and reactive to light. The right eye has injected bulbar and tarsal conjunctiva, and follicles are present. A tender pre-auricular lymph node is palpable. What is the most likely diagnosis?
Okay. So these are the different causes of the red eye. You are learning almost all important causes of red eye from this scenario. Please give the answer now.
Bacterial conjunctivitis.
Conjunctivitis.
What is the reason?
Bacterial conjunctivitis.
Dr. Sama, what is the reason?
Purulent discharge and regional lymph node lymphadenopathy.
Regional lymphadenopathy, usually bacterial infection causing lymphadenopathy, but bacterial conjunctivitis, which lymph node will be involved? You think that auricular, pre-auricular, due to the conjunctival infection. Doctor, you are thinking the conjunctival lymph nodes are drained to the pre-auricular lymph node. Okay, this is one idea.
Okay.
Any different idea?
Because because other findings all referring to conjunctivitis, pupils are equal, reactive
This
to
is
light.
good. It is
So no,
conjunctivitis, but is it bacterial or
Yes.
viral? If I come to a conclusion,
There-
you are
there is
thinking that
purulent discharge.
purulent. We discussed
Top-
before in the viral also it can be purulent. We started the talk like that. Is that it in the first slide? Maybe purulence can happen in the virus also. Interesting answer, Doctor.
Viral. Yes.
This is interesting answer because in the bacterial conjunctivitis, lymphadenopathy is unlikely, doctor, remember. Unlikely. The stickiness of the eye can happen both in the viral and bacterial. And the bacterial conjunctivitis normally results in purulent discharge with no pre-auricular lymphadenopathy. Interesting. Doctor, is it?
It happened in viral.
Yes.
lymphadenopathy?
Yeah,
Yes,
happen in
yes.
virus. This is the message. Now come to the red flags. Dangerous situation in the red eye. That means we will be thinking to manage the patient immediately and refer to the specialist. These are the red flags. Who will read the red flag, Dr. Hind? Please, it is important to read. In the red eye, the red flags.
Red flag sign of potentially dangerous red eye. Decreased visual acuity, deep vein in eye, not surface irritation as with conjunctivitis. Absent or sluggish pupil response, corneal damage or fluorescent staining, history of trauma.
Okay.
Refer the patient to
No need to
be
read it,
by
doctor. This is
specialist
just a
surgeon.
reference.
Yes.
So the message to us that whenever we come across a red eye, we need to see this thing. This is our job. Okay? Or minimum, we can ask about the symptom of such thing.